I want to share with everyone today the modern advancements made in craniocervical biomechanics by our team here at KCSC. The purpose is to demonstrate the practical applications for knee chest chiropractors rather than just fill your head with more theory. For today's video, we're going to focus on two factors. First, how our recent discoveries use spinal biomechanics to obtain an Atlas subluxation listing. And second, how the knee chest technique uses these biomechanical benefits to leverage a more efficient adjustment. As upper cervical chiropractors, have you ever wondered why this is the only upper cervical technique to adjust in the kneeling position with cervical rotation? What purpose does the palmar posture serve when you could just as easily adjust in the side posture position? Well, until 2024, there were a few theories. However, none were substantiated through modern research that had a focus on specific chiropractic technique. Rather, those theories were based on older understandings of spinal biomechanics. Research which drew its conclusions based largely on cadaver studies. What more, the research was focused mostly on what occurred between Atlas and Axis spinal biomechanics. The fallacy being is that Atlas subluxates in relation to the occipital condyles, not Axis. Clearly, updated research was needed to get a better understanding, one that was more specific to chiropractic. So in 2024, our team at KCSC undertook this momentous research endeavor. We took cervical x-rays in the maximally rotated position and began to observe what was going on with the joint biomechanics between Atlas and the occipital condyles. And what we found was truly groundbreaking. First, we noticed that Atlas was moving in a peculiar way that was never before described. We discovered that upon left cervical rotation, Atlas left lateral mass would glide posterior and inferior upon the left occipital condyle. And this held true for the opposite side as well, so that upon right cervical rotation, we would see Atlas right lateral mass gliding posterior and inferior upon the right occipital condyle. All of this being viewed in the sagittal plane upon maximal cervical rotation to that side. Next, we noticed a particularity that always affected one craniocervical joint, but not the opposite side. The joint had appeared to be locked, not exhibiting this newfound craniocervical biomechanic. Could this be the permanency aspect that B.J. Palmer wrote about when describing a three-dimensional torqued subluxation of the upper cervical spine? If so, does this mean that we just discovered a new analysis to obtain upper cervical subluxation listings based on biomechanics? So our team thoroughly tested this new theory. We adjusted Atlas only on the locked side and only when in pattern, and we adjusted on the transverse process as the contact point. We use spinal thermography pattern analysis to neurologically confirm the reduction of that subluxation. And the results were astounding. And each time, case after case, the post-thermal scan revealed significant improvements. Our theory was put into practice and a new principle of subluxation biomechanics was born. We called this new principle the KCSC paratrope X-ray. Now, how do these newfound biomechanics enhance the knee chest adjustment, providing an inherent benefit not seen with side posture adjusting? So here's a right paratrope CBCT, where the patient is maximally rotated towards the right and viewed perpendicularly to the sagittal plane. We can see here the right occipital condyle and the right lateral mass of Atlas, whereas the superior yellow dot is going to be the reference point used for the occipital condyle, and the inferior yellow dot will be the reference point used for Atlas right lateral mass. Upon right cervical rotation, we should see the reference point for atlas gliding posterior and inferior away from the occipital condyle reference point. When we compare to the left side, can you see how those reference points are much more approximated than the opposite side? This is an indicator that atlas has subluxated in the anterior and superior position against the left occipital condyle. This would be an ASL atlas subluxation listing. Simple, right? Yet so profound for chiropractic. So much so that it gets the correct subluxation listing every time. How do these findings in biomechanics provide a benefit for knee chest chiropractors? Let's take this ASL atlas subluxation listing for example. Left cervical rotation will cause atlas left lateral mass to glide posterior and inferior upon the left occipital condyle in the sagittal plane, while the locking effect of subluxation prevents a complete glide into the PI position. Cervical rotation will actually preload atlas to move into this direction. What does this all mean? Cervical rotation towards the side of laterality actually reduces the AS component of a subluxation listing. It actually preloads an AS subluxation listing more towards the PI direction of where the adjustment will guide it. How about laterality, the most significant portion of a subluxation listing? Does cervical rotation reduce laterality and preload it to the opposite direction? Here's a CBCT of left cervical rotation as viewed from P to A. Can you see here how left cervical rotation also introduces a bit of left lateral flexion? This view clearly demonstrates atlas left lateral mass gliding from superior to inferior and lateral to medial upon the left occipital condyle. In contrast, atlas right lateral mass is now gliding from inferior to superior and medial to lateral upon the right occipital condyle, as you can judge for yourself. The subluxation is being reduced on the left side, while simultaneously being preloaded towards the right side. This right here is the biomechanical benefit built into the knee chest technique. Cervical rotation towards the side of laterality will reduce the subluxation while innately guiding that vertebra towards where it belongs. Let's articulate this all together and see how cervical rotation alters the line of drive for knee chest adjusting. With side posture adjusting, the line of drive will favor superior to inferior and lateral to medial down the affected condyle. In contrast, for knee chest adjusting, the line of drive will be altered to lateral to medial down the affected condyle and inferior to superior up the opposite side condyle. This is due to cervical rotation and the preloading effect that causes upon atlas. And to accomplish this biomechanical adjustment, B.J. Palmer stood firm that the transverse process was the most efficient contact point for making this adjustment. Just judge for yourself. Can you see how the transverse process is more superficial to the skin than the posterior arch? Tell me, doctors, is it more easier to adjust on contact points that are more superficial to the skin rather than ones that are embedded deeper? I would like to thank everyone for watching and hope that you learned something new today. And for all the latest research and developments in the knee chest technique, make sure to follow us on Facebook, Instagram, TikTok, and YouTube.